Hello, my name is Dr Clare Guilding and I am the lead for admissions for medicine at Newcastle University. This is one of two short recordings I'm making, so this one is talking about the course structure at Newcastle and there will be another one that's talking about the admission and selection process here. So in terms of an overview of our course, we have got a 5-year programme for the A100 programme, and we also run an accelerated programme where the first 2 years are condensed into 1 year. And our programme is composed of year themes. So the first year theme is Essentials of Medical Practice, and within this theme, so the first year 1 and year 2 for the 5-year programme, you will be covering all of the sort of body systems. You'll be covering sort of normal physiology and behaviour, and then you'll be looking at sort of diseases and pathophysiological changes. So as well as doing all of the molecular biology, genetics, biochemistry, pharmacology, we'll also be emphasising early clinical skills that relate to the different body systems. We'll be looking at ethics, we'll be looking at your development and professional identity development as a doctor. We have got a strand running throughout it, which is clinical reasoning. So we teach you about how people think, how you would go about reasoning, how that would impact on your decision making and your ability to make a different diagnoses. And all of those things together will prepare you for entering into year 3. In fact, actually at the end of year 2, we've got what's called a transition block, so a transition to clinically based learning, where you will be doing spending a lot of time in the hospitals and the clinical sites that you will be in for year 3 to help ease that transition into the clinical years. So year 3 is going to be the first year that you're primarily located in the clinical sites around the medical school, and that year is called clinically based practice, so it introduces you into all the different clinically based elements. When you enter into year 4, you're going to be looking at more complex aspects of medicine. So you'll be looking at things like medicine's management, translational medicine, research development, so really cutting edge sort of areas of medicine. And then in year 5, we've called that one transition to medical practitioner, because that really is about transitioning you from being a medical student into being a junior doctor. So you'll be doing a lot of apprenticeships, so like on-the-job learning, embedded in the types of teams you would be embedded in as a junior doctor. Now the years 1 and 2, they are primarily campus-based, although we do have a lot of visits out to clinical centres, hospitals, GPs in those first 2 years. Years 3, 4 and 5 is located in clinical sites around the regional medical school. So you will be based in those years in a hospital and community NHS trust primarily, and we've got education leads and education teams within those trusts. You will still have links to us on the university campus. You will have regular GP placements, usually around once a week, and you'll also be having placements in mental health trusts for the mental health outcomes. In terms of where those are going to be located, well, we are a regional medical school, and this has got a number of advantages, which I'll come to in a minute. We've got around 300 general practices that we pair with around the region, and we work within 10 NHS trusts, which are listed here. So if you see from this map, the areas we cover extend to the west to Cumbria and the Lake District. Northumberland, it goes up to the Scottish borders, and down to the south of the region we get sort of County Durham and Teesside, so bordering on North Yorkshire. Now this provides massive opportunities to experience healthcare in industrialised and built-up areas, in more rural locations, and it provides a massive array of different learning opportunities, so you can get to experience rural and remote medicine as well as cutting edge massive the hospital centres that we have as well. So there's a real variety of experience that you will get that we see as a real benefit of our programme. As I mentioned earlier, one of the things that we focus on right from the start of the course is early clinical skills, and these on this slide here are some of the clinical skills you'll be doing in the first semester of first year. The first clinical skill is, obviously everybody knows this now, a really important one, hand washing. But you'll also be doing cardiopulmonary resuscitation, respiratory exams, venipuncture. We pair with a North East Ambulance Service for our first aid. And actually by the time you finish second year, you'll have done over 20 clinical skills and procedures. We have throughout the first couple of years early clinical and community experience, where you'll be going regularly to GP centres, hospitals and community centres to have clinical and community placements to apply what you've been learning on campus in a real life clinical setting. In terms of the teaching methods that we use, we've got a really strong emphasis on evidence-based and innovative teaching, and we have a lot of amazing teachers who are always trialling new types of innovative teaching techniques. But some of the things that we do are large group teaching. We do have some large group sessions. We have small group teaching and problem-based learning sessions. We can do things called team-based learning. We have interprofessional education with different healthcare students, pharmacists, nurses learning together from, about and with each other. As I said, we've got a lot of clinical skills. We do simulations, so that can be in clinical skills, or this one here is showing at the bottom a simulation in a lecture theatre where you get to vote on what you want to happen to that patient, and then you see what effect it has on them in real time. And we've got online tutorials and self-directed learning. Now, in terms of the online tutorials, these are hosted, as is everything else in our curriculum, on our medical learning environment. The medical learning environment is a bespoke online learning environment that has been built specifically for our medical programme and our medical students. So basically it does everything that we want it to do. And this in itself is again a real strength of our programme. So here you will find all of the different cases that you might be working on. You will have your timetable. So you see here all of your different timetable sessions. All of your learning resources, so any PowerPoint slides, any tutorials are held within this medical learning environment. Your lectures are recorded, so you can find the recordings there and watch them back. All the information about assessment, extracurricular activities, etc. is on this learning environment. I wanted to say a brief word about student choice. So throughout the programme, there's a variety of times when you'll get a choice in what you have to do. So for example, we have student selected components, which are various times in the year where you can choose for blocks of 4 weeks to study a particular area of medicine that really interests you. One of the ones I wanted to highlight, which is quite different and actually really unique for our medical school, is the exchanges we run with our medical school in Malaysia. So we're quite unique in having a branch campus in Malaysia that runs the identical curriculum. We have the identical learning outcomes, the identical cases as in Newcastle, UK. This here is a picture of some of our Year 2 students who were doing a semester exchange on our Malaysian branch campus, and I'm there in that picture because I ran that programme for almost 4 years. And those sorts of opportunities, the opportunities to go to Malaysia, is one that a lot of our students really do value. It is a really amazing experience. I wanted to end by talking just very briefly about our student support. We've got really fantastic student support mechanisms, both within our medical school and also within the wider Newcastle University. But I'm just going to briefly tell you some of the stuff about what we do in our medical school. One of the best things I think we have are our academic mentors. So our academic mentors, when you come in, each student will be allocated an academic mentor. And they will look after your you throughout the duration of each year. You will have a number of timetabled individual sessions with them, and you'll also have group sessions within your sort of academic seminar grouping. And they just keep an eye on you, and they make sure that you're progressing okay, that you're settling in okay, that you're doing okay in terms of development in the programme. They'll help you form development plans and help guide you where needed. We've got extra support mechanisms such as study skills support if you need a bit more help in, for example, how would you approach a particular exam or your revision technique. We can send you to our study skills support tutors. We've got peer mentors who are medical students from the years above you. And the peer mentors are really good because they've been through the programme, they've been through the different cases, the different assessments, and they can help guide you in terms of what worked well for them and what didn't. They're also really good sources of support in terms of what you might like to do extracurricularly, or things like, what might be the areas you might want to move to in subsequent years. In addition to our mentors and study skills support tutors and peer mentors, we do have a senior support tutor within the school who is there for sometimes more complex needs if you have them. This here is a photograph of our students from the first day of year 1, and what I am hoping is that some of you who are listening to this talk now will hopefully be there posing for a photo on the first day of year 1 with us in 2022. That would be fantastic. So that was just a really brief overview of the course. If you've got any queries about that, please just send them through to this MBBS admissions address, and they'll probably be directed to me or one of our programme directors. We've also got quite a lot of information about the course on these websites. So this A100 link here is for the 5-year programme, and the A101 link is for our accelerated 4-year programme. So thank you for listening.